Hi, my name is Rachel Garrett and I'm the Specialist Midwife for Smoking Cessation for East Kent Hospitals. So Public Health Kent County Council identified my post as a necessity in this area because we have the second worst prevalence for smoking at time of delivery in East Kent, this being 23%. The national ambition through the Tobacco Control Plan is to bring this down to 6% by 2022. So we do have a long way to go, but through education and support, we can do this. So when you come along and see the midwife for the very first time, she'll talk to you about many things and will also offer you carbon monoxide testing. And this is because we know that carbon monoxide has a real impact on the placenta and the child's development within the womb. So carbon monoxide is known as the silent killer. It has no odour, no colour, no taste to it, and it does take people's lives. So like I said, when you see your midwife for the very first time, she'll do a carbon monoxide reading for you, and if there is an element of risk there that you've got a higher level of carbon monoxide, then she will refer you to the 1U Kent Stop Smoking Services. In that process, myself, Liz or Claire will pick up your call and phone you on our mobile. If you don't pick up because you see it's a strange number, don't worry, we will leave you a message and we'll just have that friendly conversation with you, just having a real sort of identifying where that carbon monoxide's coming from and where we're best suited to getting you help for that. So in East Kent, we have some fantastic services that are available for you. We don't expect anybody to stop smoking overnight, so don't be afraid of that. It's not something that we're doing. We're not there to tell anybody off. We're there to give you support, and that can be for yourselves and it can be for any family member. In South Kent Coast, which is Dover, Deal, the Marshes and Folkestone, we have a wonderful home advisor that will come out to see you. She will make your first phone call to you, so you get familiar with Liz straight away. She'll then come to your home and give you support through your stop smoking process, and that's available, like I said, to all your family members as well. We also have another home advisor called Claire. She works in the Thanet area and she does exactly the same, and it's always like a one-to-one or one just in your home with another family member. They will meet you outside your home as well if you wouldn't like them to come to your home, and that can all be agreed over the telephone. In Ashford, I contact all the ladies that are referred from their midwife that have high levels of carbon monoxide. And we mustn't forget that levels of carbon monoxide aren't just found in cigarette smoke. They are found in faulty boilers, in our pollution around us. So any level of carbon monoxide that's higher than 4 parts per million, we need to have a chat with you just to make sure that we're keeping you safe and your baby safe throughout your pregnancy. So sadly in pregnancy, smoking and high levels of carbon monoxide can cause you to have an ectopic pregnancy, a miscarriage, and quite often those miscarriages are late miscarriages, stillbirth, and then problems with abruptions. So you might have a bleed in your pregnancy that may be because we've spoken about the baby becoming hypoxic, so it's not getting a good feed of oxygen. The placenta may not then be working properly, and that may causes an abruption where the placenta peels away from the uterine wall and then causes a little bit of a bleed. Lots of women also come to our hospital because they're worried about the baby's movements. And quite often if a mum continues to smoke, and sometimes women smoke 20 or more a day, then that means that the baby's being starved of oxygen at least 20 times a day. And then this leads to the baby then not having many movements in the womb. So the referral is done through your community midwife, but you can also do a self-referral, phoning 0300 123 1220. But through that referral process, we try and contact pregnant women within 24 hours, and then we will contact you at least 3 times, leaving messages for you. But if you haven't managed to pick up that phone call, speak to your midwife or give us a call, and we can put that referral through again for you to get you that help and support that you want. Okay, so when a woman goes into labour, she'll want to know who's looking after her, how much pain she's going to be in, what room she's going to be in, how long is it going to take. And when you're a smoker, those anxieties are answered by having another cigarette. And quite often, women will have more and more cigarettes because it relieves a bit of stress, it relieves a bit of pain. But in that process, baby is becoming more and more hypoxic. Remember, we said it cuts the oxygen supply and the nutrient supply through to the baby. So the baby now is really getting stressed because it's not getting enough oxygen supply. And we can then see, sometimes women have a bit of a bleed in labour, and that can be quite damaging. It can mean that the placenta will start not functioning properly, and then that can lead to a fresh stillborn. So when baby's born, you must remember that in the womb the baby is being fed nicotine and the toxins and chemicals that come from a cigarette. There's 7,000 chemicals in a cigarette, would you believe it? And these all feed through to the placenta and through to the baby. And when baby's born, baby can then actually withdraw from nicotine. So after your labour, you've worked really, really hard, you've delivered your baby, but the first thing on your mind will be that I need to get out and have a cigarette. You go out and have a cigarette, but the baby's left in the crib crying, very, very unsettled, high-pitched squeal, and quite often that's because the baby needs a cigarette as well. But I bet you wouldn't think about putting a cigarette to your baby's mouth. But this is what we quite often don't think about when baby's born. So smoking can also inhibit your breastfeeding and your breast milk supply. It affects the letdown of your milk, and quite often babies will reject your breast milk because they just don't like the taste of it. So all of these things we can try and help you with before baby comes into the world by getting you smoke free, by reducing all those toxins and chemicals that you have on your clothing, to make it a very safe environment for your baby. So when you go home with your baby, it's about keeping your environment smoke free, and this can be from your own smoking or from other people smoking around you, because any form of smoking around a child can lead to developmental delay, ADHD, autism and meningitis. Sadly, 200 babies lost their lives last year through meningitis because they lived in a smoking environment. We also know that you're 50 times more at risk of suffering a cot death if a baby is living in a smoky environment. So we need to keep you safe.